Hello, myself Mukund. I am currently a postdoc at Department of Pathology, University of Texas, Medical Branch, Galveston. So here we are mainly focused on metabolic basis of ethanol and its underlying mechanism towards the pathogenesis of alcoholic chronic pancreatitis. Pancreatitis is an inflammatory disease associated with exocrine portion of pancreas, and chronic alcohol abuse appears to be a single most risk factor for this disease. As of now, there is no specific treatment for alcoholic chronic pancreatitis as its mechanism is not clearly understood. We feel that the metabolism of ethanol itself can play a key role in pathogenesis of this disease. So when we look into the metabolism of ethanol, ethanol is predominantly metabolized in liver to acetaldehyde. Usually in chronic alcoholics, this oxidative metabolic pathway in liver appears to be inhibited. Under this condition, ethanol is converted to fatty acid ethyl esters. This non-oxidative metabolic pathway is predominantly higher in pancreas when compared to liver, and fatty acid ethyl esters found in the pancreas can cause pancreatic injury. So we hypothesize that an increased body burden of ethanol, as we see in chronic alcohol abuse, can inactivate AMPK, which can lead to increased accumulation of lipid within the pancreas, causing endoplasmic reticulum, as well as oxidative stress, inflammation, and finally chronic pancreatitis. In order to elucidate our hypothesis, we have used a deer mouse model. These mice naturally lack hepatic alcohol dehydrogenase enzyme and mimics the metabolic conditions as we see in chronic alcoholics. We have also used hepatic EDH normal deer mice. These mice were fed with ethanol for a period of 3 months. So when we look into the morphology of the pancreas, in the ethanol-fed groups of EDH negative deer mice shows a disorganization of acinar structures, interstitial edema, as well as degeneration of acinar cells. When we look into the pancreas of EDH positive deer mice, their morphology appears to be relatively normal. As expected, we see a relatively increased blood alcohol concentration in hepatic ADH negative deer mice when compared to ADH positive deer mice, followed by subsequent accumulation of fatty acid ethyl esters in the plasma as well as pancreas of ADH negative deer mice when compared to ADH positive deer mice. A significant inactivation of AMPK levels were seen in pancreas of ADH negative deer mice when compared to ADH positive deer mice, followed by increased accumulation of lipids or triglycerides in the pancreas of ADH negative deer mice when compared to ADH positive deer mice. When we look into the ultrastructures, ethanol-fed groups of ADH negative deer mice shows extensive dilatations of endoplasmic reticulum network, pycnotic nucleus, and swollen mitochondria, whereas the pancreas of ADH positive deer mice shows mild to moderate dilatations of endoplasmic reticulum network with normal and intact nucleus as well as mitochondria. Infiltrations of inflammatory cells were seen in parenchyma of ADH negative deer mice when compared to ADH positive deer mice, and pancreas exhibited significant oxidative stress in the ADH negative deer mice when compared to ADH positive deer mice. So it is likely that an increased non-oxidative metabolic pathway within the pancreas can lead to inactivation of AMPK and subsequent development of chronic pancreatitis. So I'd like to thank my mentor, Dr. Bhupendra Kafalia, my lab members, and funding from National Institute of Health as well as Department of Pathology.